Hi and welcome to this video on Complex-PTSD and BPD. My name is Joseph. I'm a psychiatrist with Epsychiatry, a telehealth mental health service provider in Australia. Complex-PTSD is a new diagnosis included in the WHO diagnostic manual that came out in 2011. It makes a space for those who have experienced prolonged, repeated traumatic experiences such as childhood abuse or torture. It brings to attention that repeated trauma sufferers can have fluctuating emotions, challenges managing relationships, and a negative view of themselves. There is symptom overlap between CPTSD and borderline personality disorder, which is a far older diagnostic construct or label. In this video, I'm going to expand on the Phoenix, Australia NHMRC approved guidelines on CPTSD, which were published in June 2020. There are timestamps here if you would like to skip ahead. Relationships. If you go back to the key features of diagnosis, BPD is typically characterized by emotionally intense and unstable relationships that shift between idealization and denigration of others and by an unstable sense of self that alternates between highly positive or negative self-evaluation. Whereas CPTSD sufferers generally view relationships as difficult and best avoided. People with CPTSD are thought to have a constantly extremely negative view of themselves. Suicidal thinking and self-harm behavior are expressed by people who have BPD. In fact, it forms part of the diagnostic criteria. However, these types of thoughts or behaviors don't form part of the diagnostic criteria for CPTSD. That doesn't mean, however, that people with CPTSD can't have these types of thoughts, and this can introduce an element of complexity to the diagnosis. Finally, BPD and CPTSD are also distinguished by the fact that CPTSD requires the presence of trauma-specific PTSD experiences for diagnoses, including a traumatic event or events, while BPD does not. There you have it, 3 ways to tell CPTSD and BPD apart. There is overlap between CPTSD and BPD presentations. Telling them apart can be a challenge. See a psychiatrist or a psychologist with an interest in trauma if you feel you could have either of these diagnoses and want further clarification and treatment. There are effective psychological treatments available, which we hope to cover in our next video. For now, send us any questions that you may have. Thanks for watching.